we struggle with in general in breast cancer, and certainly is an issue from a surgical standpoint, is that the more we look, the more we find, and the question becomes, what does that mean, and how do we treat that clinically? So a very good example is the finding of what's called micrometastatic disease. When we do a lymph node biopsy, we will find, in some cases, very, very small tumor deposits, isolated tumor cells. And they don't appear to be as if they'd gotten there by the normal mechanism. It seems a bit different. This doesn't look like a normal metastasis. It's just one or two cells noticed. And so that's certainly a product of looking more carefully at lymph nodes. And the more carefully you look, the more often you're going to find something like that. And the questions have been, well, what's causing that? What does that mean? And then what should we do about it? So there was some important data that was presented from a very big trial that was presented at San Antonio that discussed that. And again, something that I think we had all sort of felt already and we're quite comfortable with now is very well reinforced by some data that came out, that we don't treat these very aggressively if we do see micrometastatic disease in lymph nodes. So I think that's a good example of the kind of thing that was maybe not changing anyone's practice dramatically, but reinforcing something that we already that we feel comfortable with. So.